a very special nerve. Cranial nerves subserve the face. The vagus nerve subserves all the organs. And if I were to show you a picture of the vagus nerve in its entirety, rather than being a short nerve going to the face and the mouth, you'll notice over here that the vagus nerve is traveling throughout the body. And if I show you the next slide, you'll see that in actual fact, the vagus nerve touches on all the organs. So it touches on the heart, the lungs, the stomach and the gastrointestinal tract, the kidneys, the spleen, etc. So this is the crucial thing about the vagus nerve. It's a very special nerve. It's the only cranial nerve which leaves the head and neck, and it subserves all these other organ systems. I think that the next question is, why is this nerve so different from all other cranial nerves? Why did nature put that in place? And it's become quite evident that this nerve acts as the ears, eyes, nose, and mouth, I suppose, of the inner organs. So while our outer senses are giving us information about the outside world, the vagus nerve is telling the brain about our inside world. And again, if I show this to you, I'll share my screen again. You'll see over here in this diagram that this represents the organs of the body that the vagus nerve touches on. And you'll see that the arrows point in two directions. So for example, if you look at the heart over here, there are messages that the vagus nerve carries from the heart to the brain, and the brain can interpret that and send messages back to the heart. So for example, if you're climbing upstairs, the message will come that you need to have more oxygen to your muscles. The brain will then start to suggest to your heart that it should beat a little faster, and the control mechanism for the heart is really within the vagus nerve internet branch. And you'll see likewise the ear, the lungs, the pancreas, liver, kidney, spleen, and the gastrointestinal tract in particular. There is this two-way interaction between what's coming upstream, like uploading from the internet, and downstream, which is downloading through the internet. So if you think of the vagus nerve as the internet of the body, carrying messages up and down, informing the brain of our sense of well-being, then I think you've understood what the vagus nerve is all about. So if you think of it, your external sense organs are very important in giving you information about the environment in which you're living. So that if your ear nerve isn't working properly, you'll be deaf. And if your nose nerve isn't working, like in coronavirus, for example, you won't be able to smell properly. So it's now becoming evident that if this very complex internet of the body is malfunctioning in some way, it's sending the wrong messages up to the brain. The brain doesn't know that it's the wrong message, fake news, if you want to think of it that way, and it will send out appropriate instructions to the body based on the information that it receives. So it's quite possible that that information carried from the body to the brain is not exactly correct. It's not attuned correctly. It's like being short-sighted and having to have glasses put on. So if the vagus nerve is conducting information that isn't exactly correct, the brain interpretation will take that message as it comes. So consequently, you can imagine a situation where, because of the vagus not functioning properly, people start to feel unwell, not necessarily because the organ that it's subserving is abnormal, but rather that the information system is where the problem lies. So there are a number of disorders that one can immediately think of where it may be that the information system is where the problem is, or the software is the problem rather than the hardware. An example of that might be irritable bowel syndrome. I'm a gastroenterologist, and many of the patients we see complain of bloating, change of bowel habit, excessive gas, distension. And we investigate them and we find that everything looks pretty normal. The x-rays, ultrasound, endoscopy, blood tests are all normal. However, if one starts to interrogate the internet of the body or the vagus nerve, in a number of patients, you'll find that the conductor is not conducting the orchestra appropriately. And perhaps the problem lies in the vagus nerve rather than in the organ system. And the same would be true for other disorders such as headache, migraine, the condition known as fibromyalgia, people who experience palpitations without there being any problem with the heart, non-cardiac chest pain. There are numerous conditions which are very common where we can't really identify the abnormality by doing the usual tests that are available. So the vagus nerve looks to be a very important part of the software that we need to interrogate to try and understand some of these disorders which are often put down to anxiety or nervousness.